All right, thank you, Steve. Well, we've been talking about breast cancer awareness all morning, and Dr. Michael Sevilla with Salem Community Hospital back to tell us more about the latest research and treatment options when it comes to the disease. Good morning. How are you?
Good.
Tell us about breast cancer. Are we any closer to finding out what causes breast cancer and coming up with any kind of cures?
Yeah, we do know that there's a lot of research that's going on right now that's been ongoing. And when you're talking about treatments, there's three main courses of treatment. It's not all about surgery anymore. There's surgery and radiation and chemotherapy, and technology has developed so much to a point where we've been able to limit the side effects that can come from some of these treatments. As far as a cure, the research is going on, but we all remain hopeful.
Now, I was reading somewhere, somebody was saying that a lot of people, a lot of women are now doing double mastectomies, even though only one breast has cancer, just because they fear that it's going to spread.
Yes.
Is that, does having that done help, or what would you say?
Yeah, a lot of press came out about a year ago when the actress Christina Applegate came through, and she said she did have a double mastectomy. And the recommendations are right now, what she had is she had one of the genetic markers for breast cancer, which increases your risk highly for breast cancer, so she elected to do that. And it's not as controversial as it was maybe 10 or 15 years ago. We're talking about that a lot more now.
Now, also, we got to talk about men, because men can get breast cancer as well. But it's not as common, is that right?
Yes, about 1% of all breast cancers are in men, but the important statistic is that it used to be 0.5%. So we're seeing that increase a little bit. So definitely men should not ignore breast cancer. It's something that they should look out for as well.
And do men check for breast cancer the same way a woman would check for breast cancer, or how does that work?
Yeah, it's very similar. Obviously there's not as much breast tissue, so if there are kind of findings, then it would definitely be good to get that checked out by your doctor.
All right, thank you very much, Dr. Sevilla. We appreciate you coming in as always.
Thank you.
And coming up on First News this morning, we'll be right back with more.